The DRS ABCD Action Plan provides first aiders with a tool to follow when approaching the scene of an accident or emergency. The plan provides a prioritised series of actions where each letter represents a step to be taken in the care of the casualty. Each step is to be completed before moving on. D is for danger. In all situations, it is important to check for dangers to yourself, the casualty or bystanders. You're no help in the first aid situation if you become a casualty yourself. Particularly be aware of dangers such as oncoming traffic, fire, fumes, blood or electricity. If possible, remove the casualty from danger or the danger from the casualty, and only continue if safe to do so. Otherwise, wait for emergency services. R is for response. Is the casualty conscious or unconscious? Ask the casualty their name, shake their shoulders and ask them to squeeze your hands. If they respond to you, then they are conscious, so continue with the DRS ABCD Action Plan, manage any injuries and treat for shock. However, if there is no response to your touch or questions, the casualty is unconscious. Make sure they are positioned on their back to allow easy access to the airway. S is for Send for Help Now for all unconscious casualties. Call 000 for emergency services.
Fiona, we need to call 000.
Yes, we need an ambulance.
A is for airway. Open the mouth and check for foreign objects such as food or vomit. If the mouth is clear, leave the casualty on their back and open the airway by gently tilting the head and lifting the chin upward. This tilt and lift assists the movement of the tongue away from the back wall of the throat, allowing for an open and clear air passage. In the case of an infant under 1 year of age, the head should be placed in a neutral position, as tilting may cause airway obstruction. Ensure that the nose is also clear. If food or vomit is found in the mouth, turn the casualty onto their side and clear it with fingers. B is for breathing. Look for the chest rising and falling. Listen for the sound of breathing. Feel the air from their nose or mouth on your cheek, and feel and look for movement of your hand on their abdomen. Breathing should be checked for at least 10 seconds. If a person is breathing, their heart will be beating. Therefore, we turn the unconscious casualty onto their side. This side position establishes and maintains a clear airway, allowing the tongue to move forward in the mouth, facilitating drainage and reducing the risk of inhaling foreign material. When turning an unconscious casualty, handle them gently. Avoid any twisting of their head and spine. If a person is in a wheelchair or trapped, for example in a vehicle, and the airway is open and breathing is present, they can be managed without attempting to move them. The airway and breathing takes precedence over any other injuries, including a spinal injury. If the unconscious casualty was not breathing, you would commence cardiopulmonary resuscitation. C is for circulation. If the casualty is breathing, it is no longer recommended at this time to feel for a pulse. The first aider should quickly observe for other signs of circulation, such as skin colour and skin warmth. D is for deadly bleeding. Check for external bleeding, pooling or spurting blood loss. Control using the principles of pressure, elevation and rest. Check for internal deadly bleeding by looking for fluid coming from the ears, which indicates a possible fractured skull. Tenseness in the abdomen and thighs, indicating bleeding from the internal organs and major blood vessels. And finally, deformity of the limbs. With the action plan complete, whilst waiting for the ambulance, frequently check the airway, breathing and circulation. Keep the casualty warm, manage other injuries, check for identification and any medications.
Can you just tell them that he's on some sort of medication?
Yeah, we found some medication.
Telephone 000 again should you need to update any information.